Hi, this is Brian Kim. I'm going to share with you this case of a patient with an off-axis toric IOL and the repositioning of this lens. This patient was a high myope and he actually did his first eye several weeks before that, and he was 20/20 uncorrected for distance. With this lens, on the other hand, with the surgery, he ended up worse than 2400 and realized this lens was off-axis from the intended axis. And so after several weeks of figuring out what happened and what went wrong and why was it off axis, did it happen during surgery, was it an issue with the biometry? So we had to put off the surgery for about a month or so. And so you can see I was able to penetrate through the paracentesis incision, and I'm injected some intracameral lidocaine. I'm going to now, you see I'm using a hypodermic needle, breaking through the epithelium of the main incision and very carefully trying to open up the incision with this hypodermic needle. It's really not an easy technique getting that hypodermic needle up there. Once I have an opening, I'm pushing with a cannula, trying to puncture through, and I finally do. So I just push some more BSS to inflate the bag. And then I'm going in with the INA handpiece. And because I'm pretty sure that the bag has not kind of cocooned around the lens itself, I just went straight to the INA handpiece, and then I'm using the Maltzman to try and manipulate the lens into the proper axis here. So at first I tried to rotate the lens in the counterclockwise manner, but the lens is kind of stuck. And so rather than perseverating, I start to rotate the lens clockwise. And as I do so, the lens begins to spin quite nicely, turning clockwise here. I'm just using the INA handpiece to help turn the lens and maintaining continuous irrigation throughout the manipulation here. So again, there are some adhesions between the bag and the IOL here, even though it's been a few weeks after the surgery. So now I've turned the lens effectively. The lens needed to be more in the vertical meridian. It was more kind of a skewed axis before. And so now you can see the lens is about at 90, but I believe the patient needs to be at around 100. So again, I'm turning that lens a little bit more counterclockwise to the 90-degree axis here. I withdraw the INA handpiece, pushing BSS in, and then I'll hydrate my incisions. You can see how quickly the antechamber collapses. And again, this is a high myope. The scleral rigidity is reduced in these cases. You can see as I was hydrating my incision, it squirted the lens, and so now my view is a little bit obscured. So again, after checking with the axis ring, I noticed that the lens was rotated again a little bit more towards the 80-something degrees axis, and it should be more around 100-degree axis. And so I'm having to rotate the lens counterclockwise slightly, just past the 90-degree axis here to get it into the correct orientation. So I use a cannula to help position the lens as I inflate the eye, and then further hydrating the incisions, making sure I have good rhexis overlap. Hydrating the main incision again. So again, I wanted the lens to be slightly counterclockwise to the 90-degree axis here, closer to about 95-100. So place the axis ring once again. And so now I have about that 95-degree axis orientation. After inflating the eye with BSS and multiple checks with the axis ring, I do feel like this is now at the correct orientation, about 95 degrees. And the patient came back post-operative day 1 with 20/20 uncorrected vision, and he continued to have 20/20 vision uncorrected in this eye weeks after surgery. So I hope this was helpful to you, and I thank you for your attention.